So Michael, thank you for having me here at your offices in Boston. We're excited to be partnered with SV Health Ventures on your investment in Ria Health. And, you know, you've told me many times kind of the journey that your team has gone through to get to the point to make an investment in an organization like ours, but it'd be helpful just to have an understanding of what was that like for you when you looked at the marketplace, and what were some of the things that stood out from you to make the decision to partner with us?
Yeah. Well, first of all, thank you for the opportunity to partner with the Ria Health team. We're thrilled. And as you said, this investment really is the next step in a journey that started about 5 years ago for our firm, when we went through an exercise of thinking thematically about where we wanted to deploy new capital. And we determined that looking at the crisis that was occurring in substance use disorder, we wanted to have an investment in the space. It's taken 5 years to find our way to you and to find a company that captured all of the attributes that we were looking for. First and foremost, we wanted a management team that was backable, trustworthy, and combined mission and a business orientation. There are many more people passionate about solving the problem of substance use than there are those who have the business acumen to actually do something about it. And we thought that this Ria Health team has that combination. So team. Second, we wanted evidence. We wanted an evidence-based approach, and Ria's ability to deliver data, outcomes data, both for the patient and the clinician, was a critical part of our attraction to the opportunity. We wanted physician-guided care with medical treatment, and we wanted a provider that was in-network. And outpatient and telemedicine was critical to our thesis. At the highest level, we wanted to make an investment in a company that maximized the opportunity for patients who wanted to seek care, were able to get that care. And we believe that an evidence-based approach with medical-led therapy delivered via telemedicine is the best way to do that. And Ria Health literally checks all the boxes.
Great, thank you. And that's great. And you've told me that before, so hearing it again, it's really got us very inspired to continue on our mission and building this program that's going to reach so many people in the United States. One of the things that you said that really stuck out was the focus on the team. And, you know, we've been really fortunate to have attracted some really great experienced executives to the team as we move forward. And one of the things for us in getting to know the SV Health team and getting to know you was we were excited by the focus that SV Health has within the healthcare space and the depth of resources and network that you have for other operating executives in the healthcare industry. So one of the things particular for us when we were, you know, excited was just that you've had so many different portfolio companies that you've worked with, so many different executives that you've had exposure to, and the ones that you've introduced us to so far in our conversations have just been stellar, standout folks. What do you think is some of the things that sets the organizations you partner with apart as far as when it comes to team members, and what have you seen as some of the secret ingredients to the folks you've invested in?
Well, first of all, the fact that all SV Health Investors does is, as the name suggests, is invest in healthcare. We think that industry specialization gives us the benefit of perspective and meeting a lot of companies that do the same thing or participate in the healthcare ecosystem in areas that are adjacent to another. We just firmly believe in pattern recognition. And so if that's all you do with that specialization, you meet a lot of companies that are in the business. It puts you in contact with more people that are able to execute well. Common themes. Operational execution is critical when you're in a healthcare services business or a technology-enabled healthcare services business. And so we admire and respect teams that draw on prior experience, learn from the past, both the successes and the failures, and then translate that into an operating plan for the future. We believe that sales and marketing acumen is an important component. We believe that the team is usually comprised of position players, but also just great athletes that can play a bunch of different positions. You know, we are used to being the first large institutional investor, and so the situation we've got here with Ria is pretty common to us, where a company has succeeded in spite of having the luxury of a lot of capital. And so that usually instills a discipline in the management teams, doing a lot with a little. We admire those teams and believe that they'll be good stewards of our capital and our investors' capital. So we like that discipline, and we like to empower those management teams with the capital that they often haven't had in the past. We like teams that have a technology component to what they do, but in many cases, the technology investment that needs to be made going forward is less than the sales and marketing investment. And we think that that's the case with Ria as well. You've leveraged the Athena backbone. One of your founders has years of experience at Ria Health, and we fully vetted the opportunity. As you know, 2 technology reviews, feel really good about the technology platform here. There are refinements, there are enhancements, there's product line extension that you'll do. But we think the bulk of the building effort will come on the sales and marketing side. And we think that that's something that your team can do. And it's back to your initial question. We think we've got resources in our network, having backed healthcare executives for 25 years now. We think the combination of previously backed companies, our network of limited partners, our strategic advisory board will help you put you in touch with lots of resources that can be complementary to your own efforts.
Yeah, and we've seen that already, and we're appreciative of that. The expanse of your network is really impressive, and some of the things that you mentioned as far as our focus around building out our organization. We spent the past 3 years really looking at putting together 2 of the biggest building blocks in our foundation for scale. The first one being the clinical operations, and then the second one being the other aspects of operational capabilities, being able to handle the influx of patients that we're seeing coming from our commercial agreements. But what we're excited about is an area of investment from the capital that you and the other investors are putting in the company is to build out that commercial engine, to be able to overlay that on top. And when we look at the healthcare industry in general, what we've seen work effectively is not so much, put all your sales and marketing out in front and try to catch up to it, because that has unintended consequences that we've seen recently with some other large, really heavily funded healthcare companies. So we are very excited by having this new piece of the engine block on top of what has been a solid foundation for us to grow from, and look forward to using and deploying the capital in a wise and prudent way to help grow some of those commercial efforts and to get the message to our commercial partners throughout the US about this evidence-based treatment program. So we're really appreciative of it. And then the value add that comes with not only the acumen being present within all of your other portfolio companies, but just the overall team's understanding and knowledge of executing within some of the commercial frameworks that are more complicated today in the healthcare space.
Yeah, well, that's the strategy that we backed. And so it's reassuring to hear that we're all on the same page. What you've accomplished, looking back in the company's history, what you accomplished with the self-pay model is quite admirable. And that's how many companies that we've evaluated over the last 5 years have gotten started. It's your migration from there to in-network commercial insurance that was central to our thesis, though. So many companies that started in the self-pay world and are dependent on that, have a pure direct-to-consumer model that requires a lot of spending to build and maintain the brand recognition. You don't get the leverage that comes from being an in-network provider. And oftentimes the adherence and the persistence of staying on program isn't as good with on the self-pay side. So the fact that you were able to leverage your success in the self-pay world to become an in-network provider and cover the entire country with your services is really quite remarkable and was central to our thesis. And we think it gives you the opportunity to be capital efficient in leveraging your history in self-pay and now grow the in-network component of your business as the fastest area of growth.
Yeah, no, and we appreciate that observation. And one of the things that when we set out to establish our foothold in commercial payers, we knew we needed to come in with outcomes so that there was more validity than just asking for a pilot. And that was the precipice of getting into a direct-to-consumer model. But it was never the longer-term intent to ride that, primarily because we're pursuing clinical quality outcomes. And in order to really achieve the clinical quality outcomes that we think will set us apart and have set us apart from our peers, it really requires a comprehensive approach that has that aligns to the best possible way to do this, which is the combination of pharmacotherapy with psychosocial support. So by having the two of them in a very comprehensive, complete program, we're able to have our patients achieve the best possible outcomes of change that they set out to do. But that isn't always going to fit nice and easy into a consumer-based model. And so those are some of the things that we see in the marketplace today, is that there will be opportunities for people to choose what might be a direct-to-consumer pathway, but it might not necessarily be aligned to what the evidence shows as the most comprehensive, best possible approach. And so with our long-term goals, we certainly want to be accessible to everyone. That's our mission, to bring this program to all Americans. But we want to also be true to the North Star for us, which is following the evidence, providing the highest quality clinical care, and backing that up with the evidence and the data that you mentioned before. So we appreciate that observation, and we're going to continue down that path.
Good. Yeah, we love the combination of pharmacotherapy and behavioral therapy. The fact that you're able to treat not only the alcohol use disorder, but the co-occurring mental illness is a critical part of why we think that you'll be successful. We've made multiple investments in behavioral health, as I think you know, from telepsychiatry to residential psych hospitals. We believe that for the treatment of substance use disorder, it is important to remove the barriers to access, and your telemedicine play does that, and we just think that you've got all the right components.
Yeah, no, we appreciate that. And some of your historical investments, the experiences that you had early on in telehealth and telemental health, and some of the things that your entire team bring to the equation really benefit us. I think when we look at some of the opportunities for us to lead the way within our industry, in the partnership that we have with SV, I think that the things that stand out for me are being able to really deliver on not just the comorbid situations where people are, struggling with other forms of mental illness in combination with alcohol use disorder, but also taking into consideration that, today, almost 20% or more of our patients are struggling with polysubstance issues. So we hear that over and over again in the populations that we serve in the health plans that we're supporting, that the challenge may be somebody leads with an alcohol indication, but also has either cannabis or stimulants or, in some cases, opioids prevalent. So that's a big area for us, not just to address the mental illness that's present, but also to address the polysubstance. And I know that, given the breadth of your understanding in the marketplace, that's been really helpful for us to see kind of a broader picture. But we're seeing that trend drive us mainly, along with a secondary trend, which is the whole person health initiatives. And they're really related because of what you mentioned, the mental illness component combined with SUD, the Milliman study that was kind of, really highlighting kind of the opportunity for people to implement collaborative care approaches to address this. That has made its way into most of our major health plan partners' strategic imperatives over the next few years. And so when we see the collaborative care opportunity with the strategic health plan partners, they're really leaning on us to fit into that service offering and being able to achieve their whole person health goals. And one of the ways that we're able to do that is by using all the objective outcome measures that our patients are experiencing, because you really want to see, did addressing the substance use or the alcohol use disorder impact the overall health and well-being? And those are really capturing the payer's interest in making sure they have the combination of effective outcomes so that they can match that to the impact that the alcohol use disorder treatment's having on the physical side of their health experience.
Yeah, and we think that impact on the physical health side and the whole health will be critical in your discussions with payers in delivering an evidence-based return on investment, lowering the cost of downstream medical costs due to a reduction in harmful drinking days and the overall improvement in liver function and many comorbidities that are typically associated with substance use disorder. So we are absolute believers in your approach.
Great. Well, again, thank you very much for the investment and the opportunity to work with you and your investor partners. We encourage all other entrepreneurs in the healthcare space to engage with your team, especially if they're focused on key areas of innovation and growth, because we've had a great experience. So thank you.
Thanks, Tom. We look forward to working with you and the team.
Take care.